The most common infections that are caused by Candida. There are so many infections that are caused by Candida, especially the species Candida albicans, in various parts of the body. Moniliasis or oral thrush. This type of oral infection usually occurs when there is an overproduction of Candida albicans. It is also common among denture wearers and occurs to both very young and elderly who are recovering from disease or have an immune system problem. Likewise, people who are experiencing dry mouth syndrome are also prone to having candidiasis. Candida may be triggered by antibiotic treatment, which decreases normal bacteria in the mouth. Good oral hygiene is encouraged to prevent candidiasis. Dentures should also be removed, especially before going to bed. There are saliva substitutes as well as prescribed medications that may be used to treat some severe case of oral thrush. Intertrigo. This is an infection that occurs in the folds of skin, most commonly seen on overweight individuals. Redness and moisture in the skin fold are also observed. Small pustules appear around raised areas of inflamed skin and are usually filled with pus or papules around the main area of redness. Likewise, peeling, itching and swelling are also experienced. Vulvovaginitis. This is one of the most common Candida infections, found mostly in women. The symptoms include swelling and itching of the vagina along with a thick, cream or white discharge. There is also pain during intercourse. There is an observed redness with rashes that oftentimes extends to the groin area. Vulvovaginitis is dominant among pregnant women and recurs frequently in women who are using birth control pills. Men can also suffer from vulvovaginitis, and this is indicated by inflammation that can be seen on the head of the penis. There can be swelling, and also small red papules or pustules, and often a burning sensation after sexual activity. Diaper candidiasis. This is the type of infection that is commonly seen in babies due to diaper rashes. However, it should not be assumed that all diaper rashes are due to Candida. There are signs and symptoms such as small fragile pustules that are often dry and usually peel. In addition, this infection is accompanied by firm reddish nodules of 1 to 2 centimeters on the vulva or the buttocks. There is also nodular granulomatous candida or granulomatous gluteal infantum. This infection usually clears over time. Paronychia. This is an example of a Candida infection that occurs on the nails. People who contract these types of infections generally have their hands in water or handle food on a regular basis, as food encourages the growth of yeast on hands. The areas around the nails are usually swollen without the cuticles. There is also postural discharge that results to nail discoloration and oftentimes caused the removal of the nail base. This is also called lateral onycholysis. Chronic mucocutaneous candidiasis. This is an example of a recurrent Candida infection that does not respond to medical treatments. This is the type of infection is visible in the mouth and on the skin. It can be observed on infants and children. It is identified by persistent oral rashes that may be hypertrophic and produce thick plaque in the mouth. Chronic paronychia is manifested by redness around the nail folds. This infection is usually a genetic condition that is either recessive or dominant. It also may cause endocrine disorders such as hypothyroidism or hypoparathyroidism. If you suspect you are suffering with Candida, you should consult your primary care physician.